Good morning. Happy Wednesday, Team Hines. On behalf of Director Jim Doling, my name is John Beidelshees. I'm the Associate Director for Operations, and it's my pleasure to welcome you to this October 11th, 2023 Veteran Town Hall. We have a robust agenda today, and I look forward to seeing that content. But first, I want to share with you a couple of highlights and some information coming up this month. I'd like to share some information about our main campus, including commonly requested phone numbers on your screen. Today's Veteran Town Hall also highlights our Aurora Seabach. Please enjoy this video of Elizabeth Dykstra talking about the many services Aurora provides, as well as upcoming initiatives.
So we have the far west suburbs of Chicago, all the way out towards DeKalb area and up towards the north till we run into Hoffman Estates, and then down towards Plainfield until you get coverage through the Joliet-Seabach. So we have primary care, audiology, tele-mental health, telederm, and teleophthalmology. We also have social workers here in person. Coming here is a great option for your primary care and some of those additional services. On average, we have 4 to 5 primary care doctors here every day that see about 10 patients on average. We have a shuttle that goes from the Aurora Seabach to the main Hines Hospital every single day, back and forth, free of charge for all of our veterans. We've got a great team of care providers here who want to help any way we can. As a patient myself, I've seen the change, I've felt the change, and especially here at the Aurora Clinic, we're really patient-focused.
You'll find the Aurora Seabach contact information on your screen. If you have any specific questions, please comment below or send us a Facebook message. We will get back to you ASAP. The Hines Blood Drive will be held on October 13th. We invite all visitors and patients of Hines to donate blood at our next blood drive, which is going to be held on Friday, October 13th, from 9:30 a.m. to 1:45 p.m. in the Hines Auditorium at our main campus. If you are O positive or O negative donor, please consider stopping by to help stabilize the blood supply and save patient lives. Next week, October 16th through the 20th, is the inaugural Buddy Check Week, National Buddy Check Week, a national VA campaign that encourages veterans to enhance peer-to-peer connections by checking in with their veteran buddies and improve their mental health. As an initiative of the Strong Veterans Act of 2022, Buddy Check Week builds on the success of the American Legion's Buddy Check program and the Veteran Wellness Alliance Get Involved program. Take the pledge and check in with 10 of your closest veteran buddies to see how they are doing. There are going to be PACT Act information tables on October 19th at our Joliet-Seabach and on October 30th at Hines. Hines staff will be hosting PACT Act information tables from 9 a.m. to 3 p.m. at both the Joliet-Seabach on Thursday, October 19th, and at the Hines main campus on Monday, October 30th. Stop by to learn more about the PACT Act and toxic exposure screens. Finally, Veterans Day is exactly 1 month from today, and we have some great things planned to honor our nation's heroes. On Wednesday, November 8th, we will have a special outreach event featuring a performance by the St. Ignatius College Prep Band, pizza courtesy of Papa John's Pizza, bloom and toss flowers, and giveaways for veterans. Please join us for a day of music, flowers, plants, giveaways. On Saturday, November 11th, veterans at Fisher House and Freedom's Path will receive hot meals from Boston Market, and veterans in our residential care facility will receive donated holiday meals. We express our sincerest gratitude to the veterans who have served and contributed to the preservation of our country. We want to thank those organizations for their generosity in donating their time and resources to our nation's heroes. Next, we have our safety story from Francisco Marchese.
Thank you, sir, and good afternoon, everybody. Happy October 11. Today's safety story as follows. After using an automatic external defibrillator, staff members helped to put the cabinet back together with necessary supplies and medications because they didn't know how to get the device back to ready-to-use status. The cabinet remained out of commission for several days, not ready for emergency needs. Frontline staff members reached out to the quality and patient safety teams to report the concern, stating they were unsure as to the correct process for getting the AED cabinet restocked and ready to use. Quality and patient safety staff members work with biomed, logistics, and pharmacy to identify and how to reset the AED after use. The frontline staff members demonstrated a commitment to resilience and embraced the duty to speak up by reaching out to report that they did not know the process for readying the AED after use. They demonstrated a sensitivity to operations and deferring to expertise by putting in subject matter experts for a variety of departments to identify the right process to follow. And that is the safety story for today. I will be followed by Dr. Stone with the COVID updates.
Thank you for that introduction. So today's update is about COVID-19 vaccine. We're happy to announce that beginning 10/10, the 2023-24 FDA-approved COVID-19 vaccine is now available for veteran walk-ins for the hours of 8 a.m. to 3:30 p.m. Monday through Friday at the following locations below. Please note, please contact your community-based outpatient clinic or CBOC for more information. The veterans may receive COVID-19 and influenza vaccines at the same time at those following locations. Veterans also have the option to receive influenza and COVID-19 vaccines through the Care in the Community network of pharmacies and urgent care centers. This is due to current limitations in ordering of the 2023-2024 COVID-19 vaccine, so veterans may use that above option if you prefer not to wait. No prescription or referral is needed, and you can locate the vaccine site at vaccines.gov and click on Find COVID-19 Vaccines. Only veterans enrolled at the VA Care or CHAP VA are eligible to receive the vaccines at this time through the VA and through community care. Caregivers and spouses are not eligible at this time. For any vaccine questions, including supply, please call the vaccine hotline at 708-202-8358. Thank you for your time, and now I would like to introduce Erin Haranahan for an intimate partner violence update.
Good afternoon. I'm Erin Hanrahan, and I'm the Intimate Partner Violence Assistance Program Coordinator. The Intimate Partner Violence Assistance Program is also known as IPVAP, which provides comprehensive assistance to veterans, their partners, caregivers, and VA employees who are impacted by domestic violence. The VA cares about veterans affected by domestic violence and intimate partner violence, and the IPVAP program recognizes that domestic violence and intimate partner violence is a serious yet public health epidemic that affects our veterans. October is recognized as National Domestic Violence Awareness Month, and this year's theme is Building Relationship Health and Safety for Life, which aims to increase awareness of critical importance of healthy and safe relationships throughout a person's lifetime. The IPVAP services include offering support and education to identify healthy, unhealthy, and unsafe relationship behaviors, providing safety plan, assessment, and screening to identify unhealthy, unsafety, or abusive relationships, provide referrals to VA and community resources, and provide brief counseling interventions. Just to name a few, we offer RISE, which is a evidence-based individual counseling up to 8 sessions. We offer our Strength at Home program for veterans that are using anger, aggression, or violence within their intimate partner relationship. And then we also offer our Strength at Home couples program, which is an 8-week program for couples to improve their communication and reduce conflicts. I want to just mention a few awareness campaigns that we have going on. On Thursday, October 19th, is Wear Purple Day to raise awareness and show your support. And then today, we placed purple and white ribbons in the shape of an awareness ribbon outside of Building 1. So when you're on the campus, please check that out. Purple is the traditional color to raise awareness for domestic violence, and white represents men standing up to violence against women and everyone standing up against gender-based violence. If you need help or support, you can call me directly at 708-202-7243. Please also check out our public-facing website, and also watch on the Hines website and social media for additional information on IPV. Lastly, on the slide in front of you, we've learned from our veterans that they believe it's important in our healthcare system to ask about relationship health and safety, which will overall improve their physical and mental health and overall well-being. Consistent with the current VHA IPVAP policy, we will begin providing annual screening for all women veterans who are 47 years and younger. Screening will be conducted annually, and resources and referrals will be provided to support your health and safety. Eventually, all veterans will be screened at our VA healthcare system. In conclusion, please watch the 1-minute video that is provided to learn more about IPV and IPVAP services. And next, I'd like to invite Kristen Richter for Women Veteran Care Mammogram Services. Thank you.
Hi, good afternoon, everyone. My name is Kristen Richter. I am the Women's Health Program Clinical Coordinator, and I'm going to be talking about breast cancer awareness and mammogram services at Hines. So October is Breast Cancer Awareness Month. I wanted to start out with a few important facts. So except for skin cancer, breast cancer is the most common cancer among American women. And in 2023, the American Cancer Society estimates that there's going to be 297,000 new cases of breast cancer among women and 2,800 in men. And then 1 in 8 women will have breast cancer in their lifetime. So it is unfortunately something that's affecting a large portion of American women. So the best way to screen for breast cancer is with a mammogram, which is an x-ray of the breast. Mammograms can find breast cancer early before symptoms begin. And then early detection means that cancer is easier to treat and there's a better chance of survival. So VA follows the American Cancer Society guidelines for breast cancer screening in average risk women, which states that at age 40, women can talk with their provider about starting an annual screening mammogram. At age 45 through 54, they should definitely be having an annual screening mammogram. And then at age 55, they can decide to go to every 2 years or continue with annual screening mammograms. And then women who are at higher than average risk, such as those with genetic mutations or a strong family history, should talk with their provider about additional screening options and potentially starting screening before age 40. Another group of women who may want to consider mammograms before age 40 are those who meet the Service Act criteria. So the Service Act is a new law that extends access to breast cancer risk assessments and screening mammograms, if indicated, to women veterans who served in certain locations in the Middle East and had a toxic exposure. So women veterans who are younger than 40 and meet the Service Act criteria are eligible for a screening mammogram. And women veterans can contact their primary care team to schedule an appointment with their provider for the risk assessment, or they can also contact me at 708-202-7147 to do the breast cancer risk assessment and get a mammogram if indicated. So here at Hines, all of our mammograms for veterans go through the Office of Community Care. Your provider will place a community care consult, and then community care will reach out to you to schedule your preferred in-network location. And then once the mammogram is completed, the results are reported back to the ordering provider at Hines, who then will notify the patient of their results and any recommended follow-up. So I just want to stress that although mammograms are the best way to screen for breast cancer, not all breast cancers are found with mammograms. So if you do notice any changes with your breast, such as a breast lump, breast pain, nipple discharge, changes in the skin of the breast or the size of the breast, very important to contact your primary care provider right away. And then just wanted to close with a few ways to reduce the risk of breast cancer, which include maintaining a healthy weight, engaging in regular physical activity, and limiting or avoiding alcohol. So we encourage all women veterans to talk with their provider about breast cancer risk and come up with the best screening plan for them. Thank you. And next up we have Telehealth Services. Pramila Castellano is going to talk about Telehealth Services. Thank you.
Hi, good afternoon. Thank you, Christine, for introducing me. This is Pramila. I'm the Facility Telehealth Coordinator at Hines. Wanting to introduce the VA Telehealth Services that's available to the veterans anywhere, and Telehealth Initiative is part of the televised White House event as per the VA Mission Act of 2018, which authorizes the VA providers to provide telehealth services to veterans in the comfort of their own homes, across the state lines, and also off the federal property. The Office of Connected Care has increased access to the soonest and best care for veterans to access the right care in the right place at the right time. Veterans can connect with their healthcare team from anywhere, making VA healthcare more convenient, reduce travel times for vets, especially in the rural areas with limited access, and limited access to the VA healthcare facilities. The VHA Telehealth Services team consists of 12 impactful telehealth clinical technicians, one telehealth clinical technician based at each CBOC at Aurora, Oakland, Joliet, Kankakee, LaSalle, Hoffman Estates, and 4 float telehealth clinical technicians that cover the CBOCs in the absence of the regular scheduled telehealth clinical technician. We have a technology manager that manages all of the equipment and technology needed for telehealth services, and myself as the facility telehealth coordinator. There's programs in telehealth. One brings synchronous video visits, which is also known as the VA Video Connect, or VVC, is a VA solution that enables veterans to virtually meet up with their healthcare providers in the comfort of their homes. There are cell phones, laptops, and VA loan devices such as tablets that the veterans can utilize if they do not have internet connectivity or internet access to be able to connect with their providers via video visits. Virtually, when in-person appointment is not available, the virtual appointments help prevent delay in care. Other programs involved are clinical video visit, wherein veterans can come into the CBOCs and connect with their providers at Hines in the telemedicine rooms. The telepresenter or the telehealth clinical technician will set them up in the telemedicine rooms and connect them with their providers at Hines, or even at other alternate sites, other visions, such as Vision 10. And then they also have specialty clinics, such as transplant, interdisciplinary pain, mental health, and also be able to provide all of those modalities accessible to the veterans. The telepresenters also have something called as a global CAS card, or a clinical access station, which uses a virtual stethoscope, a virtual otoscope, and the telehealth clinical technicians make clinical assessments at the site at CBOC, and the Hines providers are able to view all of those assessments and provide a clinical diagnostic impression. The other programs are the asynchronous store and forward, which means the telehealth clinical technicians takes images of the veteran's retina or eye and forward it to the ophthalmologist to view and give a diagnostic impression and provide treatment recommendations. Same with teledermatology. They have a dermoscope, a microscope they utilize to get images of the skin for all different kinds of skin conditions and forward to the dermatologist or the reader, who formulates a diagnostic impression, suggests a treatment, and in some cases also schedules an in-person visit, which triggers an immediate follow-up. And these are some of the services available in telehealth. Thank you.
Good afternoon. My name is Jermaine Porter. I am the Hines Whole Health Partner here at Hines, 20-year Navy veteran, retired. Today I'd like to talk about what matters to you. This is October. October is Person-Centered Care Month, recognizing the importance of the patient and their caregivers in your health. Whole Health puts me in the center of health, which is you. Me in the middle is you. Discover your mission and aspiration and purpose and what health and wellness means to you. So this is when you have the opportunity to start that conversation for yourself and let your caregivers, let your providers know what matters to you and what you want to do with your health. Whole Health Services include orientations, taking charge of my life and health and well-being groups, health and wellness coaching, also includes complementary and integrative health care, which includes Tai Chi, mindfulness, yoga, acupuncture, and chiropractic care. So, how do you get started? Call Hines Whole Health at 708-202-2929. That's me. You can ask any Hines provider for a referral to the Whole Health Pathway, get you started any provider at any appointment. You can also download the Live Whole Health mobile app, Whole Health VA at wholehealthva.com, .gov. It's available for Android and Apple products. What matters to you will shape your plan and drive your choice of programming and clinical treatments. The road to better health and well-being starts with you here. Now I'd like to introduce Dr. Richardson, Chief of Staff.
Thank you, Ms. Porter, and good evening, everyone. Afternoon, everyone. I normally speak at the beginning of our town hall, and so a lot of the information that perhaps I would talk about you have already heard, and it's at this point in the beginning of our fiscal year and the beginning of our autumn, the important issues from the Chief of Staff are really about our prevention as we go into fall and autumn. Starting off obviously with our flu or influenza vaccination, which is available for veterans at all our clinics, and including starting last week at our drive-in clinic as well, so one can come drive in and drive out. We also have COVID vaccinations now available as of Monday, yesterday, as Monday was a holiday. The COVID vaccination and the flu vaccination can be given together. There's nothing wrong with that. But the COVID vaccination certainly for some people are to be given if recommended you are over a certain age, over the age of 65. Certainly if you have not had a vaccination in the past 2 or 3 months, preferably 3 months to wait. And even if you're boosted for all your other boosters, there is still a recommendation that you take this bivalent vaccine, the new COVID vaccine, which will help prevent your COVID infection, but even more importantly, it will help diminish the chances that infection that you do get will be a severe one. Now, COVID again is on the rise, as I'm sure you've seen and heard, across the city, across the state, and across the nation. And vaccination doesn't stop you from getting COVID, but it prevents you usually from actually having any severe symptoms. And if you do have mild symptoms, we now have oral medication that can be given, Paxlovid, that will decrease drastically your chances of being hospitalized or of getting increasingly sick. And so there are now ways in which one can prevent yourself from getting COVID and minimizing the effects of COVID when you get it. At the moment, we do have a couple of areas in the hospital that are on outbreak status, in that we have had veterans who have come in and been found to be COVID positive, or who have been hospitalized for another reason and been COVID positive. For those areas, we still are seeing and managing with our masking, or N95 masking, but in a couple of areas in our blind rehab at the moment and in our CLC at the moment, we have halted regular visitation because of the outbreak status that is occurring for the past few days. That means that for someone to have visitors, they will have to speak with the attending physician, the treatment team, or the nurse in charge to make sure that they can come in and visit. It is a temporary while we are on outbreak status. It is not general for all the facility. And so I suggest that if you are coming in to visit another veteran, just check to see whether that unit happens to be on outbreak status and what those local requirements for masking needs to be. The other vaccination in prevention that's available is the RSV, the respiratory syncytial virus, which is seen to be increasing in the extremes of age. Very young children and very old people are at risk from that. And the RSV vaccination is available, and I would suggest that you speak with your provider to decide if you are suitable and if you are required or recommended to have that vaccination. The other preventive measure I just wanted to speak about was our toxic exposure screening. You've all heard and you all know about the PACT Act, and we have set up a hotline at the VA, as well as nationally there's a hotline for talking about the possibility if you've been exposed to toxic exposures, either Afghanistan, Iran, or any of the other areas where you may have had toxic exposures. We are having 2 open clinics on the 19th at Joliet and on the 30th at Hines, where Veterans Benefits, Veterans Health Association, and also social work will be available to speak to anyone who wants to talk about, to see whether or not they need screening, to see whether or not they're at risk. But I encourage you also that there is a hotline and there is a line to our TES navigator, as that person, that screener is called. And that extension for 708-202-8387, her extension is 29084, and any veteran can phone in and find out whether or not, or schedule if they need a screening. And so that's all. The last thing I want to talk about our screening for veterans is our colon screening, which again is required, recommended, certainly for veterans who are either at high risk for colon cancer, so starting in their 40s, or if not at high risk, then generally starting in their 50s and annually thereafter, depending, every 10 years thereafter, depending on their findings on that first screening. Again, there is a program in the VA, and Hines is involved in it, to mail out test strips that you can mail back in to see whether or not you have reason to have a colonoscopy screening. This FIT program, fecal translit program, is going to be expanded to all our veterans. So you will get coming in the next month or two letters explaining why you have been chosen to participate, and requesting that you undergo this test and then mail it back in to your provider, and then your provider will report those results to you. So those are the 3 preventive measures starting this and that I wanted to bring to you. And last of all, I want to encourage everyone as the weather changes to make sure that and exercise becomes your main interest over the fall and autumn, so that you can keep healthy and see you again next month. Thank you. I hand that back over to our Assistant Director, Mr. Bidelshees.
Thank you, Dr. Richardson. We'll open it up now for any questions. Okay. Seeing none, I want to thank everyone for joining us today. I want to thank our presenters from today. Our next town hall will be on December 13th, 2023. We'll see you then. Have a happy and safe Veterans Day.